Clinical rotation in neurology for 9th semester students of the Faculty of Medicine. The neurology clinical rotation in the 9th semester is designed to equip medical students with the skills to diagnose and manage disorders of the central nervous system, brain and spinal cord, peripheral nervous system, and muscles. This rotation integrates theoretical knowledge with practical experience in neurological examinations, diagnostic procedures, and appropriate therapeutic interventions. 1. Objectives of the neurology rotation. Clinical competencies. Understand the normal and pathological functions of the nervous system. Diagnose various neurological conditions based on history taking, physical examination, and ancillary tests. Provide initial therapy for neurological disorders, including emergency management of stroke or status epilepticus. Procedural competencies. Perform a comprehensive neurological examination. Interpret diagnostic results, such as CT scans, MRI, and electroencephalography, EEG. Communication and collaboration. Build rapport with patients who may have difficulty communicating due to neurological deficits. Collaborate with multidisciplinary teams, including physiotherapists, psychiatrists, and rehabilitation specialists. 2. Learning structure and daily activities. The neurology clinical rotation takes place in various healthcare settings, such as inpatient wards, outpatient clinics, emergency rooms, and intensive care units. A. Neurology outpatient clinics activities. Evaluate patients with complaints such as chronic headaches, limb weakness, or sensory disturbances. Consult outpatients with chronic neurological diseases, such as epilepsy or Parkinson's disease. Objective: understand the process of diagnosing and managing elective neurological cases. B. Inpatient ward activities. Monitor patients with acute neurological disorders, such as ischemic stroke, central nervous system infections, e.g., encephalitis or Guillain-Barré syndrome. Discuss treatment plans with specialists and supervise patient progress. Objective: teach students the clinical course of neurological diseases from acute phases to recovery. C. Neurology emergency unit activities. Handle emergency cases such as status epilepticus, acute stroke, and severe head trauma. Determine the need for advanced imaging, such as head CT or MRI. Objective: train students to perform triage and provide initial therapy for acute neurological cases. D. Neurological intensive care unit activities. Observe the management of critical patients with hemorrhagic stroke, traumatic brain injury, or encephalopathy. Learn the use of supportive devices, such as ventilators or intracranial pressure (ICP) monitoring. Objective: Provide students with an understanding of intensive care management for severe neurological disorders. 3. Diseases and conditions covered. A. Stroke. Types of stroke: ischemic stroke, management with fibrinolytics, if criteria are met, or antiplatelets. Hemorrhagic stroke, blood pressure management and surgical intervention when indicated. Skills: use of NIHSS for stroke clinical assessment. Interpretation of CT or MRI brain results. B. Epilepsy causes: idiopathic, infections, trauma, or structural abnormalities. Management: initial stabilization in status epilepticus. Administration of anti-epileptic therapy tailored to seizure types. Skills: assisting in EEG setup and interpreting seizure patterns. C. Central nervous system infections. Types of infections: bacterial meningitis, antibiotic therapy and complication control. Encephalitis. Diagnosis and antiviral therapy. Skills: perform lumbar puncture to analyze cerebrospinal fluid. D. Head and spinal injuries conditions: head trauma, ranging from mild to severe. Stabilization and imaging indications: spinal cord trauma, neurological deficit diagnosis and spinal stabilization. Skills: neurological assessment for head and spinal trauma. E. Chronic neurological disorders: Parkinson's disease. Diagnosis based on clinical symptoms and response to dopamine therapy. Management with levodopa and rehabilitation. Multiple sclerosis. Diagnosis based on MRI findings and clinical signs. Management of flare-ups with corticosteroids. Skills: interpret MRI results for demyelination lesions. F. Peripheral neuropathy causes: diabetes mellitus, vitamin B12 deficiency, or infections like leprosy. Management: symptomatic therapy and control of underlying causes. Skills: perform peripheral nerve function tests, including reflexes and sensory evaluations. 4. Mastery of clinical procedures. Basic procedures: complete neurological examination, including consciousness, cranial nerves, motor, sensory. Coordination and reflex assessments. Cognitive function testing using the Mini Mental State Examination, MMSE. Advanced procedures, under supervision. Lumbar puncture for cerebrospinal fluid analysis. Seizure assessment using EEG. Interpretation of CT or MRI brain imaging. 5. Learning methods. A. Bedside teaching. Observation and active participation in patient neurological examinations. B. Case discussions. Analyze cases such as stroke or encephalitis to understand pathophysiology and management. C. Clinical simulations. Training in lumbar puncture and resuscitation of patients with status epilepticus. D. Observation and participation. Observe interventional procedures, such as thrombolysis or cranial decompression. 6. Assessment A. Daily evaluations. Assess skills in history taking, neurological examinations, and participation in discussions. B. Mini-CEX. Evaluate procedural skills, such as cranial nerve examination or imaging interpretation. C. OSCE. Simulation-based exams for neurological cases. D. Logbook. Document cases managed and procedures performed. 7. Challenges and opportunities. Challenges. Difficulty examining patients with communication disorders due to aphasia or motor deficits. Complexity in differential diagnosis for neurological diseases. Opportunities. Valuable experience in managing acute and chronic neurological disorders. Hands-on understanding of modern diagnostic technologies, such as MRI and EEG. Conclusion: the neurology clinical rotation prepares students to manage various nervous system disorders with a holistic approach. This experience provides a solid foundation for medical practice. Especially in neurology, students learn to recognize early signs of neurological conditions, conduct appropriate examinations, and deliver effective therapy.